Dr. Philley, thank you so much for joining us here again on Health Connection. Our topic is walking pneumonia, and we like to start these segments off with a definition. So, in that vein, what is walking pneumonia?
Well, walking pneumonia is a type of pneumonia that's less severe or milder than regular pneumonia, and it's usually caused by different bacteria. Some people don't even know that they have it, they just know that they don't feel very well, and that can last up to weeks.
How do you get it, and is it contagious?
Well, it is contagious, and unfortunately you can get it through other people that are sick. People that are coughing or sneezing, sometimes it can be transmitted in those fashions, and you can definitely get it from people that are ill around you.
You mentioned milder form. What are the symptoms? How do you know you have walking pneumonia?
Well, people can complain of a variety of symptoms. Sometimes we hear people complain of a very dry cough, and what I mean by dry is that they don't produce a lot of mucus. Some people complain of headache, severe fatigue, some low-grade fevers, joint pains, even occasionally some rashes, including a sore throat as well. I would throw that into the mix. So you can tell the symptoms can be quite broad.
Is walking pneumonia more prevalent during certain times of the year? Is there any seasonality to it?
We do tend to see walking pneumonia more commonly in the late summer months to the fall. With that being said, it can occur throughout the year, and we do see outbreaks typically every 3 to 4 years.
How do you diagnose walking pneumonia?
Well, like I mentioned, many cases are mild, and some people just fortunately get better on their own and they're never diagnosed. But if a person seeks the attention of a medical provider, usually they'll start with asking them quite a few questions about their symptoms, where they've been, what kind of sick people they've been around, and then the provider will usually do a physical exam, including listening to the heart and to the lungs. The provider then may get a chest x-ray and some lab work, which can lead to clues that diagnose walking pneumonia.
Once possessed of a diagnosis of walking pneumonia, how do you treat it?
Again, some cases don't require treatment, but when medical advice is sought, usually we give antibiotics, and that helps walking pneumonia. Many people choose also to take over-the-counter cold medicines that help alleviate some of the symptoms.
Are some people at greater risk for walking pneumonia than others? Are there things that you could say would be risk factors?
Yes, I think I could say that people that are not very healthy in general or have weakened immune systems are at risk for any type of infection, including walking pneumonia. As well, specifically people that don't have healthy lungs, people that smoke or have lung disease are also at risk for infections of the lungs.
Serious complications that can come from having walking pneumonia, are there any follow-ons, things that walking pneumonia can lead to?
Well, anytime you have mild pneumonia, unfortunately that can lead to severe pneumonia. Again, especially in people that already have lungs that are not in tip-top condition. Other things that can happen from walking pneumonia include ear difficulties, balance difficulties. Occasionally people can have low blood counts and even rashes that result either from the medication we give to treat the pneumonia or from the pneumonia itself.
The pneumonia vaccine, is it effective against walking pneumonia?
Oh, that's a great question. We fully endorse the pneumonia vaccine for people that qualify for it, but unfortunately it does not cover walking pneumonia. Walking pneumonia is usually most commonly caused from a bacteria called mycoplasma, and that is not covered in the pneumonia vaccine.
What can we do to prevent getting it and having to deal with it altogether?
Well, we're all exposed to things in our environment at all times. It'd be great if we could live in a world where we weren't exposed to bacteria or to sick people, but most of us are. Use common sense. Wash your hands. Avoid contact with extremely ill people, close contact if you can avoid it, covering your mouth when you sneeze or cough, and then as a pulmonologist I have to endorse again, it's time to quit smoking.
Thank you very much, Doctor.
Oh, thank you for having me.